Hello friends, please see this instrument. What is this called? This is called a slit lamp. You can easily see there is a joystick here and the patient puts his chin on this chin rest. Through this eyepiece, we basically examine the anterior segment, and we can also examine with the help of certain lenses the posterior segment of the eye. Let us learn more about the slit lamp. So slit lamp is basically used for seeing the anterior segment. Lot of things we can see through the slit lamp, like conjunctiva, cornea, anterior chamber depth. We can also see the aqueous humor and the various pathologies there. We can basically calculate the number of cells and flare there. We can see the iris details, and we can also see the pupillary abnormalities like sphincter tear, the lens location, and the type of cataract is also classified with the help of slit lamp. So this would be helpful for you when you are writing a short note on what are the various things that can be seen through the slit lamp. Remember that whenever we are using a slit lamp, we cannot see the structures which are behind the iris. Okay, so like our ciliary body and the ciliary processes, they cannot be seen through the slit lamp. With the help of certain lenses like 90D and 78D lenses, we can also see the posterior segment through the slit lamp. Remember, whenever we are using a 90D and 78D lens, we also have to basically see what is the correction factor that is there when we use it. As you can see in this picture, this is a patient where we are doing a gonioscopy. So remember, a gonioscopy as well as applanation tonometry, which you can see from the second figure. This is the picture through gonioscopy, and this is the picture which is we are doing a applanation tonometry. So both of these investigations which are useful in the glaucoma evaluation are done with the help of slit lamp. A question that was asked few years back was, what is the correction factor for the disc size when we do a slit lamp examination and see the fundus? So remember, whenever we are using a 60 diopter lens, we use a correction factor of 1. Whenever we are using a 78 diopter, we are using a correction factor of 1.1. And whenever we are using a 90 diopter, we are using a correction factor of 1.3. Now what this correction factor means? That means that the optic nerve size that you see with the help of a 60D lens is actually the same size which is of the disc. But when you are using a 78 diopter lens, you have to multiply the disc size by 1.1, and when you are using a 90 diopter lens, you have to multiply the size by 1.3 when you are examining the optic nerve head. Now this size is important because the patients who are having glaucoma and the patients of myopia, these patients have usually large disc size as well. So that's why it is important to note the disc size when we are talking about the cup disc ratio, as well as we are talking about the optic nerve evaluation more commonly in the patients of glaucoma.